I don't know where human beings copied some behaviors and mannerisms. I don't know. But my role as health educator is to enlighten you. Leaking your partner's private parts are serious health concerns, are serious health issues, consequences. We have lubricants in the mouth. We have lubricants in the private parts. So anytime you are leaking that part, maybe you are sucking that penis, you are leaking that vagina, you are inserting your tongue very deep in the vagina, you are scooping those lubricants, those infectious lubricants, you are introducing them to your mouth. They are going to colonize the lubricants in your mouth, and you are going to suffer from oral candidiasis. It's called oral thrush, oropharyngeal candidiasis. This can translate to oral cancer. Oral cancer. Those who are also the women also who are leaking the penis of their partners, assuming this partner has Candidal Balanitis, you are also sucking. You are sucking those lubricants, those infectious lubricants, introducing them to your mouth, and the consequences are the same. Kindly refrain. Kindly refrain. And if someone insists on you have to do that, the choice is yours. Now you know the truth. The choice is yours. I'm not the one to tell you what to do. You know the truth. It can risk your life. It can risk your health. Thank you very much, because you have heard and you are going to consider that. So what are the causes of Candidal balanitis? The causes are the same. This is not different from what we said in women. So the cause number one is overgrowth of lubricants. If those lubricants in your penis, in your vagina have overgrown, then you are going to suffer from infection. The other factor we said is high sugar content. We said avoid high sugar diets. Why? Because sugar is going to act like substrate. It's going to be food for those lubricants. And definitely wakikula washibe, they will cause infection. So I said reduce those foods that contain a lot of sugar. And I said you can eat animal proteins because they have the 9 essential amino acids. Are we together up to that point? Because the bacteria can thrive in that environment with sugar. The other thing here is diabetes. Diabetes, high sugar level will lead to insulin resistance. So where there is insulin resistance, insulin is the hormone that regulates sugar levels in your body. So where there is insulin resistance and high sugar levels, then definitely the lubricants are going to get food, the substrate, and they are going to cause infection. The other thing I said, compromised immune system. If your immune system is very compromised, maybe you have other underlying conditions like HIV/AIDS and other conditions, then you are at a higher risk of having Candidal balanitis. Okay? So compromised immune system. Maybe you may need immune boosters to boost your immune system. And if there is another underlying condition, you need treatment. The other cause could be poor hygiene. Poor hygiene around your penis, the foreskin. Please wash your gadgets very well with water, especially warm water and mild soap. Avoid those soaps that are very, very sharp, very scented. Avoid them because they can be irritable. They can be irritant to your penis. The other thing is having sexual activity with a partner who has yeast infection. I want to remind you that yeast infections are not categorized as sexually transmitted infections. But sexual activity can increase the chances of transmission of the albicans. Okay, so it is not sexually transmittable. It is not sexually transmitted infection, but sexual activity can increase the chances of this, because we said there is friction. The friction can affect the balance of the albicans. Okay. The other cause could be frequent exposure to moisture. Frequent exposure to moisture. Maybe excessive sweating and also wearing wet boxers. Wearing wet boxers. Najua wanaume, some of the times, there is this thing that men tend to do. For you to notice that your boxer is dirty, you have to do what? What do you do? You smell. So when there is some irritable smell, it's when you say, now, kumbe ni chafu. So you can wash it in a hurry, na ikose kukauka vizuri na unavalia. Wearing wet boxer, that moisture will create an environment favorable for the growth of albicans, for the overgrowth. Again, when you wash your boxer, don't fear from taking it outside to dry. Usiogope kupeleka nje, eti itaonekana na madem, itaonekana na nani. Let it dry very well. Okay? And also at night, umeshinda umesweat mchana wote. Umeshinda umeprotect, umefunika your gadgets. Please, ukifika kwa nyumba, at night, usilale na boxer. Allow the gadgets to receive some fresh air, some air circulation. Nafunika ya nini? Make sure you give them air circulation, okay? Si kila wakati tunalala na jeans, unalala na short, hey. My friend, that is very dangerous. The other thing could be tight clothing and underwears. I have said that. And also obesity. Wanaume, punguza kitambi. Punguza weight. Punguza, just cut your weight. Make sure you are not overweight. Work on your weight. Balance your weight. That cannot be overemphasized, because when you are overweight, that affects hormone production, can cause hormonal imbalance. So hormonal imbalance is also another factor, as I said. For example, when we have high levels of estrogen compared to testosterone, it can cause balanitis. Elevated insulin can also cause balanitis, and also elevated cortisol. Cortisol can be elevated because of chronic stress. So mwanaume, punguza stress. Work on your stress, because it can lead to balanitis. Lastly, I want to mention about treatment. And treatment is basically topical and fungal creams. Topical, ya kupaka, just you apply on the affected area. We have clotrimazole, miconazole, or nystatin. These are some of the creams that you can apply. And again, these are applied between 7 to 14 days. That is 1 week to 2 weeks, depending on the severity of the infection. So my main aim is not to mention the treatment, but the prevention. You have heard the causes. What causes balanitis? Work on that. Work on the causes. Manage everything. Because prevention is better than cure. If you can work on the causes that I have mentioned, you'll be free. Kwa hivyo wanaume, the ball is on our coach. It's upon us to prevent balanitis. Avoid those risky behaviors. Avoid them, the risky behaviors. I know I may sound controversial, but I'm here to enlighten you. Whether you like to hear the truth or not, mine is to enlighten you and to create awareness. And that is my goal. So, tuishi vyema, and I know we'll overcome. If you have questions, you can ask. My name is Ishmael Midi, the founder and the director of MIVHT, Mtumishi Ishmael Volunteer Health Talks. God bless you, and let's meet in my next video. Stay blessed.